An ideal submental profile is key to a more youthful look. What is the ideal profile? Let's look at this very youthful, beautiful face and the anatomical elements to consider when looking at her submental profile. There is a distinct mandibular border. You can see this sharp angle from the gonion to the mentum. A subhyoid depression right at the transition of the horizontal and vertical planes of the neck. Often, there is a visible thyroid cartilage bulge, as well as a visible border of the anterior sternocleidomastoid muscle. And it has been described in the literature that the ideal angles include a sternocleidomastoid submental angle of 90 degrees and a cervicomental angle of anywhere from 105 to 120 degrees. All of these aspects of the cervicomental angle taken together really provide that beautiful profile seen here. And that is what we want to try to achieve for our patients, to give them that more youthful look. So what is the opposite of that? Well, it's submental fullness. You can see that the angles have changed. In comparison, submental fullness is characterized by an obtuse angle greater than 120 degrees and a blunting of the cervicomental angle. You don't see that sharp definition like you did in the previous image. As well, an indistinct inferior mandibular border can be clearly visualized here on this patient. When consumers are thinking about this, they sometimes refer to this as a double chin. We know that this is a very common yet undertreated condition that detracts from a balanced, harmonious facial appearance and leads to an older and heavier look. And to date, we haven't had a non-surgical option to treat submental fullness. And this is something that patients are interested in. Submental fullness is present in a broad range of adults, including both women and men. It is influenced by several factors, including aging, genetics, and weight gain. Submental fullness can also be present in individuals who are not overweight, and it is often resistant to diet and exercise. Let's take a closer look at 3 specific causes of submental fullness. First, aging can make submental fullness more prominent. Genetics can also be a factor. A person's genetics can cause submental fullness, even in people that are young or of average weight. Excess weight can also be a contributing factor to submental fullness. It can also be multifactorial due to any combination of the 3 causes mentioned here. The presentation of submental fullness varies by the distribution of the preplatysmal fat. It can be more localized, as in the picture seen on the left, or it can present more broadly and diffusely, as in the picture on the right. The severity of submental fullness also varies widely. Here is a depiction of the range of submental fullness based on a validated scale used in the Kybella clinical trials. It represents the presentation of submental fullness from none to extreme. And the impact of submental fullness on how consumers feel about themselves is apparent. David is really frustrated, even though he is in relatively good shape. Bland